All right, I wanted to help you use a muscle percussion tool over some of the shoulder muscles, more specifically the posterior rotator cuff region, or also known as the post-cuff muscles. So what it is a combination of a few different rotator cuff muscles that can be the culprit to sensitivities or sensations that you may be feeling, and they can also be associated with shoulder movement dysfunction. So what I'd like to show you is how to use a muscle percussion tool, such as something like this, over those muscles, which should help reduce some of that sensitivity. But first, I want to show you where that region is. We're going to use the right shoulder as our example. You're going to cross your arm over, and if you can feel the back side of the shoulder, just underneath that muscle that's like right here, that's called your deltoid muscle. So this is the area all on the back side, underneath on that muscle here, and then all down the back side through here is where we'll be targeting with the muscle percussion tool. All right, so what you're gonna do is you're gonna turn your muscle percussion tool on. We typically like to use the first setting just because it tends to be more tolerable initially. So what you're gonna do is you're gonna lay on your side. So our target shoulder is the right shoulder, so we're gonna lay on your left side. So as you lay on your left side, you're gonna hold the tool in your left hand. You're gonna reach your right shoulder across around the back of your neck here. Then what you're gonna do is you're gonna use the muscle percussion tool right on that back side of that shoulder in that posterior cuff region. I'm not applying a lot of pressure. I'm just using the weight of the tool. The hand that is holding the tool is supported on the ground or the table, so it's not a lot of exertion on my body as far as trying to maintain this position to target those rotator cuff muscles on the back side here. So if you find an area that's tender or sensitive, go ahead and spend a little bit of time on it and try to reduce some of that sensitivity. Some areas may be a little more sensitive than others, and that is completely okay. Then I'm gonna work my way down just on the back side of the shoulder here, kind of just working, trying to find and explore any area that is causing a little sensation change, whether it be a little discomforting. Sometimes it could even be a little bit of pain, but you don't want to cause a whole lot of that. You want to listen to your body. It'll tell you what you're able to tolerate. So I typically use this for about 30 seconds to a minute in that area, and then we perform other therapeutic interventions to fix why these muscles have to be desensitized. And that's how you use a muscle percussion tool over the back portion of your shoulder. Hope this was helpful, and I'll see you in the next video.